I was mentally prepared to die.
He didn't know what was going to happen next.
He was walking around with a time bomb in him.
I think she was starting to feel helpless.
That was just like a kick in the stomach to her.
The doctor made me feel that I'm in a very unhealthy state.
Next, two medical mysteries that defied the experts. Calvin Hill is tormented by terrifying episodes of night sweats, high fevers, and terrible back pain. Doctors can't explain why it's happening, but are convinced that dangerous open-heart surgery is his only option.
Right or wrong, live or die, I was either going to end it one way or the other.
Then, for 20 years, Joanne Citrone dealt with the embarrassing results of what she thought was a garden-variety hormone imbalance, until she learns that her mysterious condition could have deadly consequences.
The worst fear that I would have was that I was going to die.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. "56-year-old Calvin Hill is a member of the Georgia State House of Representatives. Having served in the military before getting into politics, he's always been an active and busy man.
I was in the Marine Corps, and I think that started my lifelong desire to stay physically fit.
He's a very dynamic person. He doesn't like to just sit and do nothing. He has to constantly be involved in some project.
Calvin's a very energetic person, very driven. Nothing could slow him down.
But Calvin was forced to slow down briefly in 1990 to have a pacemaker installed.
And that was done primarily for an electrical short circuit that sometimes made my heart beat irregular or would stop.
The procedure went off without a hitch, and for years Calvin didn't think twice about his health. But then, one spring day over a decade later, that all changed.
Spring in Georgia is very messy. And Calvin is a neat freak and was going to pressure wash the driveway and the deck.
I must have hit a wasp nest, which was underneath the deck, and a tremendous amount of wasps came out and attacked me by hitting me on my leg. And even though I know better, I took the pressure washer and tried to knock the wasp off my leg.
Before he knows what's happening, 3,000 pounds per square inch of pressurized water rip into Calvin's flesh, virtually sanding off several layers of skin.
I was amazed at the severity of what the pressure washer did. I mean, it literally looked like it just took the skin right off the bottom of his calf, and you could see, like flesh.
I really didn't even consider going to the doctor myself. I felt that it was something that I could clean up with a little bit of alcohol and hydrogen peroxide, and it would heal up in a few days.
Calvin's prediction is right. After a few weeks, all that remains of the accident is a small scab on his leg. But a month later, as he and his wife prepare for a 10-day vacation to Belize, Calvin starts feeling strange.
I began to start having the sweats. I felt nauseated. My back would hurt particularly, flu-like symptoms.
I said, well, we can postpone the trip. We don't need to go. He insisted that he was okay. It's just a bug. It'll be gone.
Calvin and Cheryl decide to go ahead with their trip. But during the flight to Belize, he takes a turn for the worse.
I was beginning to run a temperature, started sweating, and was feeling very, very bad. Started having a pain, particularly in my lower back.
Once the plane touches down, Calvin is so miserable, all he can think about is getting to their hotel.
Usually we go to the local place and have a beer and meet all our old friends, and there was none of that. He just went to bed.
I was strongly beginning to believe that I did have a kidney stone because of the tremendous pain in my lower back. It was extremely intense, and I would pant very rapidly to reduce the pain.
Calvin tries to gut it out by staying in bed and taking whatever remedy he can get his hands on.
My wife went to the local store and got cranberry juice because I thought, well, flushing my system would help. So I lived on cranberry juice for 2 or 3 days until we exhausted all the juice in that part of the country. And I was not getting better. If anything, I was getting worse.
They quickly realize that vacation or no, Calvin needs help.
I called our doctor in the States and I said he's got a bad infection of some sort, and he told me we needed to get Cipro, which is an antibiotic.
Cheryl manages to track down the Cipro, but it doesn't seem to have any effect on Calvin. In fact, he appears to be getting worse.
I would go through a range of different symptoms. My fever would go way up. I would start sweating, shaking uncontrollably, and that's in a place where it's very hot. I was getting quite concerned that I had something much more than the flu.
And a few days later, another frightening symptom develops.
I started coughing blood after about a week of being sick like this. I called my doctor one more time and told him about that, and he said to see him as soon as I got back.
The day after he returns, Calvin heads to his doctor's office, hoping for some relief.
He took some tests, sent me in for an x-ray, came back and said, I have pneumonia. That's why you're coughing up blood, and immediately put me on strong antibiotics to knock it out of my system.
Calvin takes the 4-day course of intravenous antibiotics, certain that this should take care of the problem.
I made a return visit to my doctor, who took another x-ray, and he was a little puzzled because my lungs did not clear up. So he immediately referred me to a pulmonologist in our area. The pulmonologist said, yes, I had a very severe case of pneumonia and was actually lucky that I had lived through it, and kept me on a high dosage of various antibiotics and treated me over the next month or so. And it seems like the cloudiness in the lungs never totally went away like anticipated.
When the doctor would look at his lung x-ray, there was shadows. It was dark in some area, and she attributed that to scar tissue left over from the pneumonia.
The scar tissue theory seems to make sense, and over the next few months, Calvin begins feeling better. He figures the episode is behind him.
But I thought most everything had gone away. And then that fall, I started having some of the same symptoms. I'd start getting these chills, and then I would break out in the sweats. Some nights they would be very severe, and some nights they would be very minor.
He would wake up and his neck would be wet. He kept telling me it's like a sprinkler inside has just gone off. We started putting a towel in the bed because we were changing the bedding every day. He'd sweat through the mattress pad. It was awful. His fever would get really high. It got as high as 104. And once the fever would break, and it would just be gone.
Calvin checks in with his doctor about the relapse and is given pain relievers, but they don't help. His symptoms persist, and their patterns remain the same.
It was almost a joke to me that when I go back into the doctor, he'd say, what do you feel like? What are your symptoms? And I say, well, read your records from the last time I was here, rather than me re-explaining them or writing them all down again.
And then, one day, Calvin experiences an episode that is nothing short of terrifying.
I was at a meeting in Atlanta, and all of a sudden, I started feeling extremely ill, again with the pain where I almost couldn't move.
He felt flushed and clammy, and the pain in his back was back. It was worse. He could not sit up in his chair at the meeting. So he called his doctor and told him, I feel terrible. Something is definitely wrong with me. And the doctor said at that time to go to the emergency room.
Calvin rushes to the emergency room, and after one night of x-rays and tests, he is met by an infectious disease specialist for an examination.
He thought that through our various international travels that I may have picked up some sort of strange and exotic disease from another part of the world. And I thought, well, now we have an opportunity to find out what's really wrong with me. So he pulled a tremendous amount of blood work and went to work looking for one of these infectious diseases.
But when the blood work comes back, it looks fine. No parasites, no amoebas. And though Calvin is still in pain, the hospital can't find a reason to keep him. After just one night, Calvin is sent home.
He was really bad shape. He hurt so bad he couldn't stand up. And that is when he ended up going back to the pulmonologist, and they ordered a CT scan.
A CT scan provides a more precise picture than the X-rays Calvin has had previously.
The morning after the CT scan, Calvin and I were in bed. The phone rang, and I answered the phone, and it was Calvin's doctor, and she wanted to talk to him.
She said, Calvin, get immediately to the hospital, to the emergency room, because you have a pulmonary embolism and you should be hospitalized. I wasn't sure if I was going to live to get to the hospital or not. "56-year-old Calvin Hill is being rushed to the hospital. His doctor has just discovered that he has suffered a pulmonary embolism, a blood clot in the lung that can kill almost instantly. I was extremely frightened. At that point, I really didn't know what a pulmonary embolism was. All I knew is it was quite often deadly.
It scared us a lot that he was walking around with a time bomb in him, basically.
At the hospital, Calvin is immediately put on blood thinners to prevent another clot from forming in his lung. For now, it seems he has dodged a bullet.
We did feel that that was the cause of all the other problems. He was feeling confident that they'd found it and it's over. And we would just go along with the treatment. And if he had to stay on blood thinners the rest of his life, he'd do that.
The pulmonary embolism scare is over, but Calvin's symptoms, night sweats, high temperatures, and excruciating back pain continue on and off for months. And then, in October 2004, the bullet he thought he dodged returns when he's brought to his knees by another pulmonary embolism.
And this really intensified my fear because I was afraid just one more time I would get a big embolism and that would be it. So I was extremely fearful on how many more I could possibly survive.
And it keeps happening.
So at the time I was having 4, 5, or 6 pulmonary embolisms, some of them big and some of them fairly minor. They just keep intensifying. It feels like you've been shot in the stomach with a cannonball or a bowling ball. And literally a couple of times it has just knocked me to the ground.
We were certain that there's some underlying cause that nobody seems to be able to find out. That there is a disease hiding in there, and maybe it sleeps for a while and then it comes back.
And I felt again like a revolving door. I would get well for a while and then I'd end up back in the hospital a couple months later. I felt that I was sinking a little bit lower and lower every time. I was not recovering as quickly or as well as I had before.
I was really starting to get concerned because in my mind, most of the people that he sought medical assistance or help from had enough time to come up with an answer of why he had been feeling the way he had been feeling. That felt like they were just throwing darts in the dark. And they didn't even know if they were hitting the wall, let alone the board.
I thought medical science had advanced to such a point that I could not accept that they couldn't find the root of my illness and the root of my disease.
I mean, after a while you think, okay, this is just the way it's going to be forever, and finally I'm going to just die. And I know he was resigned to that. He was over it by then. You don't accept your husband not wanting to live or not thinking he's going to live. We just pushed on, I did what I could to make him feel better. We listened to the doctors, we told them the stories, and they would all come back with no answers for us.
For 2 years, Calvin is on a roller coaster with no answers.
They were scratching their heads. They didn't have a clue what was going on.
Then Calvin tries a new tactic.
I started mentioning to them the fact that I did have a pacemaker, and the last time my pacemaker was changed out, a defective lead was discovered, and they tried to remove it, but they could not because it had really grown into my heart and into my blood vessels. And so instead they just cut it off and capped it at both ends and inserted new leads.
Doctors seize on this and suggest that perhaps the defunct pacemaker lead could be causing abnormal growths in Calvin's chest, creating the clots. The next step is to meet with a top cardiologist to see if anything could be done about it.
He talked about the possibility of an open heart surgery where they filleted these wires out of my body, go back and put in a new pacemaker. He said it had a tremendous downside. He said it's probably about a 60% chance that I would die on the operating table.
Calvin is petrified. His odds of living are worse than a coin flip, but he feels like this is his only chance.
Going through the heart surgery seemed like, I guess, my only option, my last option of finding out what was causing these pulmonary embolisms and getting it fixed once and for all, right or wrong, live or die. At least I'm getting it over with. I was either going to end it one way or the other.
For 2 years, Calvin Hill has miraculously survived multiple pulmonary embolisms, for which his doctors can find no cause.
We didn't want to keep harping on the negative things that were happening, but there was no doubt that we all felt like he didn't have a whole lot of time with us.
After ruling out the usual sources, a piece of his pacemaker stands out as the only possible culprit. So the day before Thanksgiving 2005, he is admitted to the hospital for an extremely risky heart surgery. Doctors have told Calvin he's got a 40% chance of coming out of it alive.
Well, the day that I was going in for surgery was rather quick. Went in extremely early in the morning. They came in and prepped me, got me all ready. I think emotionally I was kind of ready. I was almost eager to get this over with, though I started getting extremely nervous.
We weren't sure that when we said goodbye in the room that we'd ever see each other again.
I think we stayed away from the serious discussions until right at the very end when they rolled me down toward surgery. Then we said our goodbyes and told each other how much we loved each other. And I still remember those moments very clearly and obviously get a little emotional about them.
It's just a horrible feeling to know that 1 minute you're talking to somebody that is part of your life, and over the next couple hours, you don't know if they're going to be around.
I was mentally prepared to die. I was, making my peace, praying, if you will, and just saying, God, do whatever you want to with me. I'm yours. We waited quite a while. I'm not sure, perhaps half hour, 45 minutes. And the surgeon was coming, so they were doing the last-minute preparations. He walked into the room, and I think to everybody's surprise, at that point he said, "Stop. The danger of cutting into your heart is too great. I'd probably kill you." And he says, "I don't want to take that chance. I'd rather call off the surgery and halt it." "Does that mean you want to do it tomorrow?" And he said, "No, I don't think we should do it at all."
The feeling I think we had was the climax that never came. It was like we'd built up to this point for so long, and then the surgery didn't happen.
You take a deep breath and you think, wow, at least he's here. But again, almost instantly in my mind is, what next? Does he have to live his life like this forever? He didn't know what was going to happen next. He just knew that they weren't going to perform the surgery.
Calvin doesn't know where to turn. The next few months are relatively quiet, but then in March of 2006, the terrifying symptoms return, and he fears it's another pulmonary embolism. At his wit's end, Calvin consults another team of cardiologists, but their conclusion only frustrates him more.
And they again decided the underlying cause for this PE must be somewhere in my pacemaker. And they said, "Mr. Hill, we know exactly what we need to do to you. We need to cut your heart open and take that thing out of you."
Calvin can't believe what he's hearing. The doctors want to open up his chest and remove his pacemaker, the exact same operation that his last doctor aborted because it was too dangerous.
And at that point, I think my frustration level just peaked. And I said, "No, you're not. I don't think that's it anymore. I think you're wrong, and I think everybody else is wrong. You're not going to cut into me. You're not going to kill me." I realized that all these different specialists were probably right in what they were finding, but they were not able to find a cause. And there had to be somebody else that could look at all of these tests, somebody we hadn't talked to yet.
Calvin reaches his boiling point and is walking a fine line, but he's determined to find the solution.
I went to our insurance company and went up as high as I could get and said, "I can't stand this anymore. What I'd like you to do is go to your best doctor or doctors.
I don't care if they're in the system or out of the system.
Want to find the best doctors in the state of Georgia.
I don't care how much it's going to cost.
Have them pull all of my records, talk to all of my specialists.
I am dying.
And see if we can find another cause for this.
I need to be fixed.
During this period of time, they documented about 6 pulmonary embolisms. I was beginning to wonder how many lives this cat had.
Calvin Hill is fed up. He's spent almost 3 years suffering bizarre symptoms and life-threatening pulmonary problems, only to be bounced from doctor to doctor, getting no real answer.
The doctors did not indicate they had any idea what was wrong, and they had no answer for us.
After narrowly avoiding a procedure that most likely would have killed him, Calvin demands his insurance company find him a doctor who can get to the bottom of his illness. And in March 2006, Calvin meets with Dr. Rob Schreiner, a pulmonologist.
From time to time, I'm asked to see patients who have been ill for a long time and have seen a number of physicians and yet weren't well. Calvin was such a patient.
Dr. Schreiner had a very, very good record of exactly what did happen.
You know, it was like a fresh set of eyes looking at everything that had happened.
And after scouring all of Calvin's records, test results, and x-rays, Dr. Schreiner notices something strange about Calvin's case.
In classic pulmonary emboli, you get huge clots. And those kind of large-sized blood clots, or pulmonary emboli, shut off blood supply to the heart and kill you. That's not the type of blood clot that Calvin was having. He was having small blood clots in small arteries of the lung. The picture that was emerging for me was that of a so-called systemic illness, an illness that was affecting tissues and organs all over his body, not just one tissue or one organ. Secondly, I believed it had an inflammatory character.
This is a real departure from anything Calvin has heard from doctors in the past.
The pattern of Calvin's illness, plus the absence of getting better with medicine designed to treat pulmonary emboli, plus the recognition that I had seen this exact illness in many patients before, all led me to the diagnosis of vasculitis.
Vasculitis is an illness in which the immune system attacks the body's own blood vessels. The vessels become inflamed and swollen, causing pain, ruptures, and in some cases, a breakdown in normal organ functions. It affects thousands of Americans each year.
Calvin was surviving these repeated episodes of blood clot because he wasn't having pulmonary emboli syndrome. He was having blood clots form in the chest as a result of the vasculitis.
While doctors are unsure what exactly triggers vasculitis, in some cases, it has been known to occur after an injury, burn, or infection.
At that point, I said, well, you know, doctor, there's one thing I did not tell you. It was a couple months before the first time I had these symptoms that I had this injury to my leg. And for him, it was one of those aha moments where he says, that is probably the trigger.
It also becomes clear that the kind of vasculitis Calvin is suffering from is particularly rare and complex.
In some patients, there is a blend of 2 or more vasculitis syndromes. And in those patients, we consider them to have this thing called polyangiitis overlap. Poly meaning many, angiitis meaning inflammation of the blood vessels.
Dr. Schreiner believes that this complication may help explain why Calvin went undiagnosed for all those years.
Calvin saw at least 7 different specialty doctors. I'm not sure that any one of them was thinking about the big picture. They held on tightly to the belief that Calvin had pulmonary emboli, but he was just a particularly unusual case.
One thing is for certain, Calvin is extremely lucky that he was diagnosed when he was.
I think that if Calvin had continued along the same path and we had not arrived at the one correct diagnosis, Calvin would have had diminishing function of his lungs and other tissues and organs. I think eventually it would have killed him.
Dr. Schreiner prescribes Calvin prednisone, a steroid, and cyclophosphamide, an immunosuppressant. These medications are used to calm down his overactive immune system.
And I guess it was probably about 6 months later that I realized, hey, I'm feeling pretty good. And all those symptoms seemed to have gone away.
Today, Calvin is feeling better and hopeful that he has a long future ahead of him.
Calvin did what all of us should do. If we're doing what our doctors are asking and we're undergoing tests, but we aren't getting better, we've got to advocate for ourselves.
I think if I hadn't made the final decision to talk to my insurance company and tell them I needed something else, I'm sure I'd probably be dead by now.
When Calvin Hill was confronted with the possibility of his own death, he fought back and regained control of his health. But years of chronic symptoms and disinterested doctors almost forced Joanne Citrone to give up on ever finding a cure. Joanne Citrone was the baby of her family, an upbeat and healthy kid brought up in a tight-knit Italian family in New Jersey.
As a child, I loved to play sports. I was very athletic, enjoyed playing basketball.
She was a beautiful child, lots of fun.
And just like many young women, Joanne first starts her period at age 13. But 2 years later, something strange happens.
At the age of 15, my menstrual cycle stopped. It was kind of devastating. Everything was going so normal. Why did this stop?
At first, I thought, well, this is just temporary. But after quite a lapse of her not getting her period, I knew something wasn't right. And I made the first appointment to our gynecologist.
The gynecologist runs a battery of tests and performs a full exam.
The pap smear was normal, but the blood test did reveal a high level of testosterone in my bloodstream.
Testosterone is a hormone that is responsible for the development of masculine characteristics. Mostly produced in the testes in males, smaller amounts are produced in a woman's ovaries.
The doctors said, you really should take her to an endocrinologist, and that's what I did.
He went over the blood work that the first doctor performed on me and stated that they were going to run some more tests.
The endocrinologist felt that putting her on a mild birth control pill would stabilize her period and bring it back to when normal.
Joanne goes on the birth control pill, and after 2 months, her period returns. Her blood still shows high testosterone levels, but her doctor doesn't seem worried.
He really didn't make much of it.
We just discussed it that yes, it is still high, but continue on the birth control pill, and this was something that I had to accept.
After a few more months, Joanne's period is coming regularly. But soon, she sees another change.
In 1 year, I went up at least 50 pounds. I just look swollen, and I hated looking like that.
Joanne is told the weight gain is a side effect of the pill. And though she exercises daily and watches her diet, nothing changes.
I myself couldn't understand it. You know, she went to Weight Watchers for many years, and she still wasn't losing any real weight.
I joined the gym. I was doing aerobics. And it was just such a slow-moving weight loss.
Then another embarrassing symptom begins to develop.
Body odor. I was told the body odor was from being a teenager, being more active. I didn't feel myself or see myself sweating anymore. I would try every deodorant possible and it just didn't seem to help.
And when Joanne turns 17, another bizarre symptom appears. Brown spots on the back of her neck, elbows, and knees.
It actually looked like my elbows were just filled with dirt. And that was very embarrassing because people would comment, "Oh, do you have dirt on your elbows?" I said, "No, this was my color." And they was like, "Oh."
I first noticed a couple brown spots. I couldn't figure it out.
My mother told me to use lemons, rub lemons on my elbows to just decrease the color.
I thought that lemon, being acid, would lighten the color of her elbows.
And that's what I did, and it didn't work.
Joanne checks in with her endocrinologist every 3 months for blood tests, and she tells him about the disturbing changes her body is going through.
And when I would ask him about the other symptoms, he would try to just figure out ways to help me persevere with them.
This is really the most difficult thing for me as a mother. You know, you go to a doctor, they're telling you, oh, everything is, is just a little high, but there was no treatment to be done for her.
Joanne accepts her doctor's findings and goes through college just managing her symptoms day to day. At age 22, she meets Scott Citrone, and they begin a 3-year romance.
Scott and I were forming a really nice bond together as a couple, and there really wasn't any reason to worry about any type of symptoms I was having.
She never made a big deal about her doctor's visits. She did tell me about the high testosterone level, but the other symptoms were not real visible to me at the first. You know, she looked and seemed normal, healthy. I wasn't concerned about it at all.
In June of 1996, Joanne and Scott marry. A few months later, Joanne stops taking the pill for the first time in 10 years.
I was told a high level of testosterone might affect me when it's time to have a baby, but it's not a big deal because, you're on a good track receiving menstrual cycles. When I'm told nothing's to worry about, I just move on and don't worry about it.
1 month goes by with no period and no pregnancy. Joanne isn't expecting immediate results, so she and Scott remain patient. But then, one day, she notices something disturbing.
Whiskers started popping out. I did not feel like I was an attractive wife. And when I talked to the doctor about that, he says it's very common for when you reach a different period of time in your life. But I was only 26 at that time.
A girl puts makeup on and you hope that your lipstick is on right. Imagine worrying, I wonder if I have a new hair that just appeared.
Anytime I would see a stray hair, I would pluck it.
Every night, it was just something she had to do before she went to bed.
Months go by with no periods and several negative pregnancy tests. Joanne's doctor tells her to check her temperature daily to track her ovulation. He also prescribes Clomid, a fertility drug used to induce ovulation, but nothing works.
I think she was starting to feel helpless. Why is this happening to me? It was heartbreaking to hear your daughter with such a plea.
Six-year-old Joanne Citrone has been suffering for over 10 years with bizarre and embarrassing symptoms: weight gain, body odor, discolored skin, facial hair. She has also been unable to conceive a child. Her doctors say these are all results of elevated testosterone levels, but are nothing serious to worry about.
We had confidence with the doctor's diagnosis, and there wasn't any questioning of why I continually had high testosterone every 3 months of my blood work. So you just move on and live life.
Desperate to get pregnant, Joanne continues with her regimen of fertility drugs. But after 3 months and no pregnancy, her doctor delivers some bad news.
He told me he couldn't treat me anymore for my infertility if the Clomid wasn't jump-starting. He reached his limits of what he could do for us as a couple trying to conceive a child. I felt really failed by him. Why? After going to a doctor for 10 years, didn't he fix me?
It just seemed like he did all he could and he was done. And he just pushed us off onto someone else.
But Joanne is determined to have a baby. And of all the symptoms she endures, her infertility is the only one she is not willing to accept. Eventually, she decides to go to a fertility clinic.
During consultation, I gave the doctors the full 10-year background of why I was going to the endocrinologist. And I did mention high testosterone to him. There was never even an emphasis on how we're going to handle that. Their emphasis was to produce a baby for us. Never during that time frame was my high testosterone noted, checked, concerned about, nothing.
It seemed like it was forgotten about.
Over the next few years, Joanne endures 6 artificial inseminations, none of which result in pregnancy. The next step is in vitro fertilization.
They were able to retrieve 48 eggs, 30-some were fertilized, they implanted them. 10 days later, we were pregnant, and it was a really good feeling at that point.
But their joy over this pregnancy is short-lived.
My girlfriend took me out to one of our favorite restaurants. and I feel these twinges, and I started spotting. And immediately we left, so they had to drive me to my aunt's house right up the street. And I had to call Scott, and as I'm calling on the phone, I feel something just drop. I miscarried at my aunt's house.
Joanne is crushed. She immediately abandons the fertility treatments and seeks out the opinion of a new OB/GYN in Philadelphia.
He looked at all my levels, and he looked at the fact that I did not have a period since 15. He just said that even if I did get pregnant again, it would be a non-viable pregnancy. Give up the fact that you can have a child.
The eggs aren't good. You're not going to have a child. Get over it.
The doctor confirms that Joanne's eggs are compromised because of her high testosterone levels, but he informs her that non-viable eggs are the least of her problems. Her history of irregular periods puts her at risk for a deadly disease that none of her other doctors, all these years, had ever mentioned. Cancer.
That's all I had to hear. That was enough for me to say that we're done. You're going to get back on the pill and you're going to regulate yourself.
The doctor really made me feel that I'm in a very unhealthy state.
The doctor visit is shocking, but a reality check. They decide to pursue adoption, and Scott urges her to see a new doctor in order to get her testosterone levels under control.
Well, I go into the endocrinologist, and he said, Joanne, what other symptoms of polycystic ovarian syndrome have you had? I've never even heard of polycystic ovarian syndrome. What is that?
Polycystic ovary syndrome, or PCOS, is a hormonal disorder in which the ovaries overproduce testosterone. While Joanne has known since the beginning that she suffered from an imbalance in her testosterone levels, she'd never actually been given a diagnosis before. The recommended treatment is to go back on the birth control pill.
So I did walk out of that office with that diagnosis. I accepted it. I didn't care about anything anymore. I was done with doctors.
Joanne Citrone is eager to put over 10 years of infertility and other bizarre symptoms behind her. In 2001, she and Scott adopt a son, and 3 years later, she's ready to give him a sibling. But Scott is still concerned about her testosterone levels and the chance that she might be at risk for cancer.
I finally said that, if there's a chance that you're going to not be around to help me raise this child, no, we're not going to do it.
The only way we were able to start proceedings for our second adoption was that if I saw another doctor. Because in his mind, I was going to get cancer if I did not take care of my high testosterone issues.
Joanne is loath to get back on the medical merry-go-round. But then her mother, Connie, comes across an article in a magazine featuring a doctor who specializes in polycystic ovary syndrome, or PCOS, the hormonal condition Joanne believes she has.
As I read this article, I became very, very excited. I couldn't wait till Joanne returned home. As soon as she got in the door, I said, "You have to call this doctor."
I said, Mom, I'm done with the doctors. I don't want to do it. A couple days went by, and that article sat right on our kitchen table. It was like drawing me.
Joanne soon makes an appointment with Dr. Catherine Sharif, the specialist featured in the article.
Joanne told me that she had been told for years that she had very high testosterone levels, but not where it came from and what to do about it. There is no normal situation where a woman would have a high testosterone level. Normal is probably under 50. Joanne's testosterone was probably the highest I've ever seen in 10 years of practice.
Joanne's testosterone tops the charts at 107. And after reviewing her records, test results, and performing a thorough exam, Dr. Sharif confirms the PCOS diagnosis. But she also tells Joanne something she'd never heard before.
She had high insulin levels. I don't think anyone had ever explained that to her.
Women with PCOS commonly have high levels of the hormone insulin. This can lead to high testosterone, menstrual problems, and weight gain, among other things.
The brown patches on the back of the neck or on your knuckles, knees, or elbows are classic for very high insulin levels, which we call insulin resistance.
And she said, well, it's a good chance that if you start this insulin-resistant medicine, that you'll be able to get a period on your own.
Joanne takes the medication for 3 months and then returns to Dr. Sharif's office for a checkup.
My insulin numbers went down, but my testosterone still remained high.
She couldn't believe it because she was feeling so good. She had lost some weight, and that was just like a kick in the stomach to her.
When I saw that Joanne's testosterone hadn't changed in 3 months, I thought she may not have polycystic ovary syndrome, because if it was coming from her ovaries, the testosterone would have dropped with the treatment. I mean, I have nearly 1,000 patients now, and the testosterone always drops in 3 months. Something didn't match up.
Dr. Sharif is beginning to think that perhaps Joanne does not have PCOS at all, and that her high testosterone is coming from somewhere other than her ovaries. She decides to try something. She prescribes a different drug, a steroid called dexamethasone. If it works, Dr. Sharif will have isolated the source of the testosterone and have a new diagnosis.
After 3 months of taking this tiny dose of steroids, Joanne started to get periods and her testosterone level dropped dramatically. And then I knew exactly what she had. It confirmed the diagnosis of non-classical congenital adrenal hyperplasia.
Non-classical congenital adrenal hyperplasia is caused by an enzyme deficiency in the adrenal glands located on top of the kidneys, which secrete the hormones cortisol, aldosterone, and tiny amounts of testosterone. Normally, this enzyme helps to keep hormone production in balance. In Joanne, the enzyme wasn't functioning, which led her adrenal glands to produce more than double the amount of testosterone that she needed. While not as problematic for men, the excess testosterone in a woman can result in body odor, weight gain, facial hair, and in some cases, infertility.
It's an amazing feeling to finally have an answer to that underlying question we've been wanting to know for years now.
Finally having a diagnosis is a load off both of our minds.
But Joanne still wonders why it took her so long to get the right treatment.
I think the reason that congenital adrenal hyperplasia goes undetected is, number one, it's very rare, and number two, it's really hard to understand the pathways that lead to it.
The critical clue was discovering where the testosterone was coming from and realizing that Joanne did not have the more common PCOS.
Polycystic ovary syndrome can be confused with non-classical congenital adrenal hyperplasia. Both women have high levels of testosterone. One is coming from the ovaries and the other is coming from the adrenal glands, but you can't tell that when you look at someone. There's no bad hormones or good hormones. There's only balances of hormones. If you don't have a balance of hormones in your body, you have all kinds of problems.
If Joanne had not been diagnosed, her chances of developing diabetes, high blood pressure, and endometrial cancer were high. But now that she's on the proper medication, Joanne's progress has been excellent. Her symptoms are a thing of the past, and it might even be possible for her to conceive in the future.
My testosterone reduces every time I go for my blood work.
Everything seems to be getting back to normal, and she's energetic, she's happy, she feels healthy again, and it's amazing the difference in her.
I feel like I have been rejuvenated with my body. My mind is at ease.